Jessica and I will be performing a shoulder trigger today. I have my tube detented to 40 inches. I have it centered to my IR here. I placed my right marker because in my right it says that this patient is having right shoulder pain, so I already placed that there. And I have my shield all ready to go. I am going to use a technique ballpark range of 75 to 16 for the internal and external AP projections of the shoulder. So now I am ready to grab my patient. Hello, Ms. Lopez. Hi, you can come right over here. My name is Jessica and I'm from the radiology department. Can I please have you verify your full name?
Yeah, Jessica Lopez.
Okay, and your date of birth?
4/14/85.
Great, and what brings you in today?
I'm having a right shoulder.
Right shoulder, okay. Is there any chance that you may be pregnant? No? Okay, is there any necklaces that you have on or wear a bra? Okay, great, so we're all ready to go. So we're gonna have you just stand just like this, okay? And have a 10 by 12 crosswise IR already placed in the bucky. So I'm gonna my central raise will be 1 inch inferior to the coracoid process. So I'm just going to move you just a little bit right over here. 1 inch inferior to the coracoid process. And I'm going to have you just face the wall there. Okay. Show my patient. I'm going to step out in the surface and I'm going to have you actually still face the wall, please. I'm going to have you just rotate your arm in, just like that. So that's going to be my internal AP projection of the shoulder here. Okay, so Ms. Lopez, please take in a deep breath and hold. Breathe. Relax your arm. Take out the IR. I'll be right back. Take out the IR. Go ahead and bring it over here. And I'm going to relieve it. Grab a clean IR, 10 by 12 crosswise. I'm going to place it in here. Gotta make sure it's centered. I'm detented to 40 inches. And now I'm going to set up for my external AP projection. So for this one, I'm just going to have you, yes, great, thank you. And still face the wall. And the central raise 1 inch inferior to the coracoid process. And my patient is shield, ballpark 75/16 technique. Ms. Lopez, please take in a deep breath and hold. Okay, breathe. Okay, can you relax your arms? I'll be right back. Okay, I'm going to check this image. So I'm going to take out my IR over here. Read it, grab a clean one, and now I'm going to set up for my Y view, scapular YRAO oblique projection. So for this one, so for my PA oblique, I'm going to have you facing the board here. And I place my 10 by 12 lengthwise for this one. And I am centered here, detented to 40 inches. Okay, so I'm going to have you just straighten just a little bit. So my CR is perpendicular to the scapulohumeral joint. So I'm going to have my right marker here. So that looks good to me. So now I'm going to go ahead and step out. Give me a second. And I'm going to use about 85/16 as a technique, ballpark range. Okay, Ms. Lopez, take in a deep breath. Actually, go ahead and breathe. I forgot to do one thing. Can you raise your right hand? Your right? Yeah, thank you. Okay, 1 second. Okay, Ms. Lopez, take in a deep breath. Hold it. Okay, now breathe. Okay. I'm going to take out this. You can go ahead and relax your arm. I'll be right back. Taking out my IR. I'm going to bring it over here. Read it, scan it, grab a clean one, and I'm going to set up for my next exam. Now I'm set up for my superior inferior axial projection of her right shoulder joint. I have an SID of 40 inches. My tube is angled 5 to 15 degrees through the shoulder joint towards the elbow. I'm going to use a technique of about 75 at 5 and place my right marker. My patient is Shields here. And so now I'm ready to go for my exam. So can you face your head that way? Away? Yeah. So I'm making sure that your head is on the head. So I'm going to go ahead. Okay, hold your breath. Okay, breathe. Alright, so we're all sit here and you can go ahead and relax your arm. I'll go around this image and I'll be right back. I have my 10 by 12 IR, scanning it, and now I'm going to go relieve my patient. Okay, Ms. Lopez, we're all ready. All set for today, okay? Thank you. I hope you feel better. I'll be evaluating the right shoulder AP projection with an external rotation. The first thing we see here is that the greater tubercle is in profile on the lateral side of the humerus. We also see that the humeral head is in profile, which is right here. And the outline of the lesser tubercle is between the humeral head and greater tubercle, so it's right here. And then we also see that the scapulohumeral joint with a slight overlap of the humeral head on the glenoid cavity, which is right here. Now we'll go on to the internal rotation AP projection of the shoulder. And we have let's see. So the first thing we see is that the lesser tubercle is in profile and pointing medially. So it's right here where these arrows are actually pointing here. We also have the outline of the greater tubercle, which is superimposed in the humeral head, which is right here, imposing the humeral head. And there's also a greater amount of humeral overlap of the glenoid cavity, which is right here. Then in the external one, which is right here, we see that there's more. You can see it more versus on the internal, where there is more of a overlap in the glenoid cavity here. I will now talk about my scapular Y view that I did for the shoulder joint, the PA oblique projection. So let's see here. So there is evidence, this is actually the right shoulder, and there is evidence of proper collimation here. We see that the scapula is in lateral profile, which is right over here, with the lateral and vertebrae borders in which they're superimposed. We see that there's soft tissue and bony tubercular detail in their image here. We see that there's no superimposition of the scapular body over the bony thorax. We see that there is also humeral head in the glenoid cavity, which are superimposed, which is right over here. Here's the humeral head in the glenoid cavity. There's a humeral shaft right over here, and the scapular body, which is superimposed. Let's see, the acromion projected, which is projected laterally and free of superimposition. So here's the acromion here, here's the coracoid process, here's the body of the scapula, and we see the inferior angle here as well as the humerus here. So there is the scapular Y. And then also I will be evaluating the superior inferior axial projection of the shoulder joint. Let's see, we have the clavicle here, the coracoid process, the lesser tubercle, the humerus, and we have the acromion right here. So for evaluation here, we have evidence of proper collimation. This is also a left shoulder, by the way. And we also see the lesser tubercle and profile here, which is right there. The AC joint through the humeral head, And then there's soft tissue in the axial with bony tubercular detail. We see that the coracoid process right here is projected above the clavicle. Right here. And we also see the scapulohumeral joint right there, and which is not open. Let's see, and there's evidence of proper collimation, and that is my evaluation for all three images here. Let's see what I can